Hey everyone! Welcome back to Zen Zone Health. We're excited to be sharing another video with you today. Now let's talk about something that might make you squirm a little bit. Root canals. We're diving deep into a topic that sparked a lot of debate in the dental world. We're going to break down why I made the decision to stop performing root canals in my practice, and trust me, it wasn't a decision I took lightly. Get ready to understand the ins and outs of root canals, the potential risks involved, and what alternatives are out there. Make sure to subscribe to our channel for more health insights. Let's get started. So, what exactly is a root canal? Imagine this. Deep inside your tooth, beneath that hard enamel you brush every day, lies the pulp. It's the living part of your tooth, full of nerves and blood vessels. When decay-causing bacteria decide to throw a party in your mouth, they can eat through the enamel and infect this pulp. Ouch, right? This infection can cause some serious pain and discomfort, and that's where the root canal comes in. The goal of a root canal is to remove that infected or dead pulp from the tooth, clean out the canals where the pulp resided, and seal it up tight to prevent further damage. It's like evicting those pesky bacteria from their little tooth apartment. Think of it like this. Your tooth is like a house, and the pulp is the living room. When unwanted guests, bacteria, trash the living room, you need to clean it out and make sure they can't get back in. For many years, dentists, including myself, saw root canals as a way to save teeth and prevent extractions. And while it's true that a root canal can alleviate pain and infection in the short term, there's more to the story. Over time, I began to see potential downsides to root canals that made me question their long-term benefits. So let's dive into those concerns, shall we? Remember those bacteria we talked about? The ones that love to party in your teeth? Well, it turns out that even with a root canal, some of those tiny troublemakers can stick around. You see, the canals inside your teeth are like tiny, intricate mazes. And while dentists do their best to clean them out during a root canal, it's practically impossible to get every single bacterium. Now you might be thinking, okay, some bacteria are left behind, but they're sealed inside the tooth, right? And you'd be right, to an extent. But here's the thing that really made me stop and think. These bacteria, even in a dormant state, can release toxins. And these toxins? They don't just stay put in your tooth. There's a growing body of research suggesting that they can actually leak out into your bloodstream and potentially cause inflammation in other parts of your body. We're talking about potential links to heart disease, autoimmune disorders, and even neurological conditions. Now, I'm not saying that every single root canal will lead to these serious health problems. But as a doctor who's committed to the overall well-being of my patients, I couldn't ignore this emerging research. It raised serious red flags for me and made me reconsider the long-term impact of leaving even a potentially infected tooth in the body. Let's talk about another important factor that made me rethink root canals' blood supply. Now, you might not think about your teeth having their own blood supply, but they do. Just like any other part of your body, your teeth need blood flow to stay healthy and resilient. That blood brings in oxygen, nutrients, and all the good stuff that helps your body fight off infection. But here's the catch. When a tooth undergoes a root canal, that vital blood supply to the tooth is cut off. It's like cutting the lifeline to a city. The tooth is still there, but it's no longer as alive and capable of defending itself. Without a blood supply, the tooth becomes more vulnerable. It's like a fortress without any soldiers to protect it. If bacteria decide to launch another attack, the tooth's natural defenses are compromised. This lack of blood flow also makes it incredibly difficult for your body's immune system to do its job effectively. Imagine trying to fight off an invasion when you can't send reinforcements to the battleground. It's an uphill battle. So we have a situation where potentially harmful bacteria might be lurking, and the tooth's natural ability to fight back is weakened. That's a combination that made me step back and explore other options for my patients. Now, this next part might sound a bit graphic, but bear with me because it's important. When we perform a root canal, we're essentially leaving behind a small amount of dead tissue inside the tooth. We clean out as much as we can, but it's impossible to remove every last bit. Now, in most areas of the body, our bodies are incredibly efficient at removing dead tissue. It's a natural process that helps us heal and stay healthy. But the environment inside a root canal-treated tooth is different. It's a dark, moist, and enclosed space, the perfect breeding ground for bacteria. And remember, without a blood supply, the body's ability to clear out this dead tissue is significantly hindered. Some experts believe that this dead tissue, even in small amounts, can act as a reservoir for bacteria and toxins. It's like leaving a piece of spoiled food in your refrigerator. It might not cause immediate harm, but over time it can contaminate the surrounding environment. This concept of leaving dead tissue in the body was a major turning point in my thinking about root canals. Our bodies are designed to heal, and I believe that, whenever possible, we should work with our body's natural processes, not against them. Now you might be thinking, okay, Dr. Kulacz, root canals sound kind of scary. But what are my options if I have a severely infected tooth? I'm glad you asked. The good news is that there are alternatives to root canals, and I want to empower you to have open and honest conversations with your dentist about all of your options. One alternative is extraction, which involves removing the tooth entirely. While this might seem drastic, it can sometimes be the best course of action, especially if the infection is severe or the tooth is already significantly damaged. But don't worry, extracting a tooth doesn't mean you're stuck with a gap in your smile. We have fantastic options for replacing missing teeth, such as dental implants, which are like artificial tooth roots that fuse with your jawbone, and bridges, which are prosthetic teeth anchored to adjacent teeth. Another alternative is pulp capping, which is a procedure that aims to preserve the living pulp of the tooth. It's typically done when the decay is caught early on, and the pulp is still healthy. The bottom line is, you have options. Don't be afraid to ask your dentist about all of them and discuss the risks and benefits of each one. Now, let's talk about the best way to deal with root canals, avoiding them altogether. Just like with many other health concerns, prevention is key when it comes to maintaining a healthy smile. And the good news is that there are simple, everyday steps you can take to drastically reduce your risk of needing a root canal. First and foremost, let's talk about sugar. Sugar is like fuel for the bacteria in your mouth, and we want to starve those bacteria, not feed them. So, limit your intake of sugary drinks, processed foods, and sweets. Next up, brushing and flossing. You've heard it a million times, but that's because it's so important. Brushing twice a day and flossing once a day helps remove plaque and food particles that can lead to decay. And finally, see your dentist regularly. Regular checkups and cleanings are crucial for catching problems early on before they have a chance to escalate into something more serious. Remember, a healthy smile is a reflection of a healthy body. Thanks for sticking with me through this deep dive into the world of root canals. I know it's a lot of information to process, but I believe that knowledge is power when it comes to making informed decisions about your health. If you found this video helpful, give it a thumbs up and share it with your friends. Let's spread the word about the importance of oral health and empower each other to make choices that support our overall well-being. Don't forget to subscribe and hit the bell icon for more health tips and insights. Stay healthy and see you next time.